Hello, this is Dr. T from First Class Pediatric Dentistry, answering another one of the questions that we commonly get in practice and that I get on my emergency phone quite a bit, honestly. So I have to start by saying that this isn't meant to take the place of any medical advice that you would get, or dental advice for that matter, that you would get from a provider. So if you're not in this practice or you're not a patient in this practice, please visit your healthcare provider so that they can give you a more thorough evaluation and give you information that's more specific to your situation. So I'll start by saying your child has a tooth knocked out. So most of the time I'm going to get this call in a couple of different ways. Some folks kind of feel like the tooth was supposed to come out anyway, so there's a little less concern. But other times it's out of the blue and you're not really 100% sure what's going on. You just know that your child's lost a tooth. So whether you're in the first situation or the second situation, the goal is just to make sure that everything is the way it's supposed to be. So in pediatric dentistry, what we typically do is we actually start with an evaluation of systems outside of the mouth. So what I mean by that is we start by doing a neurologic exam. We will also try to make sure that you're cleared with a couple of other systems. So the neurologic exam really is just trying to make sure that you don't have any damage to your face or your brain, honestly. So we want to make sure that you haven't sustained a concussion or your child hasn't sustained a concussion, and that there are no facial injuries. So none of the muscles or nerves in the face are damaged. So that's usually where we'll start. And following that, then we try to make sure that we've also cleared you of any respiratory, or cleared your child, I should say, of any respiratory issues. So we want to make sure that no tooth fragments were taken into the lungs, a process that's called aspiration. We want to make sure there's no aspiration, and we want to make sure that you're not having any difficulty, your child isn't having any difficulty breathing. We also want to make sure that nothing was swallowed and taken into the gastrointestinal tract that shouldn't be down there. So those are two things that we evaluate in addition to the concussion and the facial injuries. So getting to the dental part of it, we always make sure that there are no jaw fractures and that you have the normal, what we call range of motion, or just that your jaw moves the way it's supposed to move and that everything's in place and looks the way it's supposed to be, it's supposed to look. So we'll always evaluate that, and then we kind of get to the teeth and the soft tissues in the mouth as the last thing, and probably where we do the more thorough exam. So we always look at your child's age. So if your child is 3 or 4, we kind of treat it differently than if your child is 12 or 16. So if your child is 3 or 4 and they've knocked out a tooth and you can confirm that the full tooth has been knocked out, then we are almost universally not going to ask you to put that tooth back in. So we're almost always just going to say, okay, put the tooth in some milk, bring it in, we'll make sure that we can figure out what's going on. So once you come in, 9 times out of 10, like I said, we're not going to put the tooth back in. We're just going to make sure that everything else is fine. There are no pieces of tooth still in the socket. There's no other structures that have been damaged. So usually if your child is young enough, we're typically not going to put the tooth back in. We're just going to wait until the permanent tooth starts coming in. Now, if you're the parent of an older child that's 12 or even 8, 16, that has permanent teeth in the front, they've knocked out a tooth that you can confirm is a permanent tooth. What we ask that you do is you actually put that tooth under some warm water and rinse it off. You don't want to scrub it, just rinse it off a little bit. And then you actually put the tooth back in the socket that it came out of. And the reason for that is because time is of the essence if your child has knocked out a permanent tooth. And the quicker you get that tooth back in the socket, no matter who does it, the better off your child's going to end up being at the end of the day. So once they've got the tooth put back in the socket, the next thing is to call your dentist as quickly as possible and try to get in as quickly as possible so that they can get to work on the situation with the trauma. I hope that this video was helpful. I know it's not going to give you all the information you need, but hopefully it can get you started so that you can kind of have a step-by-step process that you're going to use to try to ensure that your child gets the best result possible. Thank you.